Hello, my name is Paula Ryan. I work in the University Hospital Limerick. I don't know if any of you know me. I know one of our patients is here today, and a friend of mine is also. I work with Dr. Aidan O'Brien and Dr. Brian Castley, so work with the consultants. And what I want to speak about is, I suppose, the role of the nurse and how to make the journey for patients a little bit more easier. I have a tendency to talk fast, so I'm going to try my best to slow down and talk louder, okay? So when a patient is diagnosed with idiopathic pulmonary fibrosis, there's a lot of terms that are used, a lot of terms that you may not have ever heard of before. So you can have a dry, debilitating cough, you can have UIP, IPF, pulmonary fibrosis, and then, like the consultant was saying, the causes for it and whether it's medication or different things are all mentioned, and they can all be mentioned quite quickly in very short appointment times. So I suppose the role for the nurse is to try and alleviate any concerns and educate patients and ensure that you know why or what's happening in appointments. So what is the role also with the patients can feel very miserable and very short of breath even before they present into the expert centres or into the kind of bigger hospitals, and they may have had already 2 years of symptoms before they came and got a diagnosis, or many more. So the consultant already explained this, idiopathic pulmonary fibrosis. As a nurse, what we're trying to do is spend a little bit more time with patients to explain what the disease means. So idiopathic, that it's an unknown cause, that it's involving your lungs, and that it's scarring of your lungs. There's many investigations that you will have to get to your diagnosis stage, and in those investigations, I feel in our outpatients clinics, what we do is sit with patients and explain the process and explain what the investigations are and why you're getting them. So like your pulmonary function tests, to try, like the doctor was saying, to see your FVC, doing certain blood tests, doing your oxygen tests, and that's something we would do in clinic, is do a 6-minute walk test. So i.e. patient walking for 6 minutes, putting on an oxygen oximeter and looking at your oxygen levels and your pulse and seeing, do your oxygen levels drop when you walk, and what distance can you walk. A chest x-ray can be very informative at the early stages, and then to go and get a high resolution CT scan. It can be very daunting for patients. I know in our clinic, it's a very busy clinic. There could be 20, 30, 40 patients waiting to see a consultant, some of the doctors, and then the respiratory nurse team. I believe we do it very well in Limerick, and what we do is the respiratory nurse team is kind of down another corridor, and once Dr. O'Brien or Dr. Castley has given a diagnosis to a patient, they're brought down to the respiratory nurses to spend time with the respiratory nurses to kind of educate patients on the disease, talk about the disease. And everyone has different worries or concerns, to talk about what your worries and what your concerns are. A lot of people are informed today, and people can look up Google very easily, and you see 2 to 5 years of living, and that's very scary, and that's where we need to be able to sit down and have a chat about that, and maybe talk about medications like the antifibrotic medications and options that will suit you. So supporting and preparing for patients. We had a patient, for example, on Tuesday that came in and got his diagnosis, first diagnosis from Dr. Aidan O'Brien. So that patient was brought to us. Dr. O'Brien wants to start him on antifibrotic medication, but he felt on that day he'd had too much information. So we sat down with the patient, re-educated him on the disease and what the disease meant, and told him that there was 2 options for medication. We're bringing him back next week to talk about which medication will suit him and what medication we will choose for him. So it's about spending, from a nursing point of view, spending time with your patients and getting to know your patients, because like the consultant was saying, there is side effects from these medications, and we need to be able to see those side effects early. So we see our patients once a month when they start on antifibrotic medications to talk about the side effects and talk about how the medication is working for you. There's other things we talk about, which is patients that do smoke, which is quitting smoking. I think it's the thing I talk about every single day in all diseases. Getting plenty of rest, talking with your family, trying to be as healthy as you can, follow a healthy diet, be active on whatever activity you can do, practice relaxation techniques, and join a support group. And there is a lot of support groups around Ireland now, and we've got really great people setting up support groups with the support of ILFA as well. We have a support group in Limerick. Noreen O'Carroll, you probably know of her. She's on the ILFA website, has set up our local support group, and it's really beginning to take off. It was quite slow in comparison to our COPD support group, where there's a lot more people in it, and they're a little bit more proactive, but it's beginning to get there in Limerick, thankfully, and I'm sure it's the same across the country. I think they have a brilliant one in Dublin. Patients have concerns like, why did I get this? Why did I get IPF? And like we've said already, there is an unknown cause, but there is some risk factors that include like smoking, environmental exposures, maybe viral infections, maybe there's a genetic factor with it, or GI reflux disease. In the country at the moment, what we're trying to do is kind of create a national database just to learn a little bit more about the disease, and those questions like the maybe genetic factor are in that, trying to build a relationship with it. The medications, the antifibrotic medications, as we know, there's the two medications, pirfenidone and nintedanib, and pirfenidone is on the market now since about 2010 or 11, I think it is, and nintedanib last year. And it is great to have an option for patients now in comparison to before, where we had nothing to talk about options as antibiotics to slow the progression of the disease for patients. And I've really seen a big difference since 2010 to 2018 in the patients that we're seeing. We're thankfully seeing them sooner. They're not as advanced maybe in their disease for some patients. And I have seen the medication work for some patients. I've really seen it's slowing the progression down for those patients. Pulmonary rehab, and Irene's going to talk more about pulmonary rehab, but it really is beneficial for patients. And I know in the Mater Hospital, they have a ILD, or pulmonary fibrosis specified pulmonary rehab program, and they're the only place in the country that do that. In Limerick, what we do is they go on the same program with all other patients that might have COPD or asthma, depending on patients' needs. But what we try and do with our pulmonary fibrosis patients is we try and fast track them into the pulmonary rehab group. It is something we would like to do, is have a pulmonary rehab just for ILD, but we don't have it just yet. But if you were within the University Hospital Limerick area and you were diagnosed within our group, you would be fast tracked into the pulmonary rehab. Lung transplant is an option, and we would refer most of our patients for lung transplant and then work with the team in the Mater in Dublin for lung transplant. And we've been fortunate to have some patients to have lung transplant and been a great success. And oxygen therapy. And oxygen therapy is something that we would assess on each clinic appointment to see patients' oxygen needs, and then prescribe oxygen depending on their needs. And like for someone maybe that is flying, it's all about trying to find the right type of oxygen for your journey and the right type of oxygen that you need for your needs also. Will I need oxygen? It's a difficult question to answer. Everyone is different, and some patients just need it for when they're sitting down. Some patients need it for activity, and some patients only might need 1 or 2 litres, and it's different for everyone. So I think as a nurse, what we're trying to do is educate patients on how much they need and what they need their oxygen for. And oxygen is not something most people want to have, but if you need it and you feel the benefits of it, it can be very helpful for your life. Health-related quality of life can be significantly impaired with IPF. Dyspnea and cough is very common for patients, and if we know about your symptoms and how you're feeling, if you are very short of breath or if you have cough, we can work with you to try and alleviate those for you. Depression and anxiety can be very common, and I think everything is about education and awareness and learning. And once we know if you're feeling down or isolated, we can talk about that and maybe introduce you to like our support group locally, or we can talk to you about physically moving more or joining a pulmonary rehab group with us. We can talk, once we know your concerns, we can try and work with you on those concerns and alleviate those for you. The impact of dyspnea, cough and fatigue can be overwhelming for patients, and I think once we're informed, we can work on those. The shortness of breath and cough and fatigue, there's different, like the 2,000 steps, We can do the 2,000 steps and introduce you to ILFA. They're very good and very informative. But we can also, if someone has a significant cough, we can give different medications that might help with your cough. Also, the antifibrotic medication can help slow the progression of disease, so it can also have some impact on your symptoms and how you feel. I'm not going to read all of this with the case study, but I just want to tell you about a patient that we had in Limerick. We've 3 hospitals within the University Hospital Limerick group, covering an area of 400,000 people. So it's quite a big area. We go back to kind of Lahinch, really, on one side of the country, and up to North Tip also. But we had one gentleman, a 65-year-old man, who was living with his wife and 2 grown-up children. He was a non-smoker with no occupational hazards, and he was diagnosed with IPF, and he was started on antifibrotic medication, and he was doing extremely, extremely well on his antifibrotic medication. And we sent him for out to Ennis Hospital for his follow-up appointments for some of them. We have a respiratory nurse in Ennis called Carmel, and Carmel and I would link very closely, and the nurses that we have in Limerick very closely with Carmel. What we would do once a patient is diagnosed and started on an antifibrotic medication, we would educate them about their disease and about the side effects of antifibrotics, and then we would give them our mobile phone number. We would see them once a month. So for this particular patient, we saw him, we initiated therapy, we saw him a month later in Limerick, and then for his follow-up appointments for 3 or 4 months, Carmel would see him, and if Carmel has any problems, she would link back into us, and we would bring him back into the centre, and that's what happened. And we were doing really, really well with this gentleman. He then was referred to Pulmonary Rehab, and again, we've Pulmonary Rehab in Ennis and Nina Hospital, so off-sites also, which is great. So this gentleman went to Pulmonary Rehab in Ennis Hospital, and in Ennis Hospital, in the Pulmonary Rehab, you've access to obviously physiotherapists who run it, you've palliative care team that can help with some of your symptoms like your shortness of breath. I think historically palliative care was, people think end of life, when it's not. It's all about symptom management and managing how you feel. Dietitian, which is great for helping you, to encourage you to eat, because some of the side effects of medication you can quite feel nausea or lack of appetite, so a dietitian input is really important. Nursing staff, and I think the nursing staff within the University Hospital Limerick group, Carmel and I and the other girls, we would link quite closely to each other, so it's a direct link back to the consultant, because the consultant really is centred to that also for patients, and it's a direct link. If a patient is at home and feeling unwell, they might ring us and we can talk then directly to the consultant, and maybe that patient might be getting an exacerbation, we can bring them into the hospital on direction of the consultant then. So it's good to have that relationship with the nursing team if you're diagnosed with IPF. This gentleman had an exacerbation then, and in an exacerbation he had an infection, he was admitted to hospital, and he was really feeling quite unwell, and his baseline, I suppose, dropped quite significantly after his exacerbation. There's an awful lot of things we try to do to prevent exacerbations, like encouraging patients to get flu vaccines and pneumococcal vaccines, taking their anti-acid medications like Nexium or Proteum or any of those to help for gastric reflux, because it can be quite common with patients that have pulmonary fibrosis, and to minimise exposures to air pollutions. But this gentleman had an exacerbation, and he had been referred to transplant, and he went back up to the Mater and he was seen in transplant. He got a transplant. He was a very fortunate gentleman. He was on 15 litres of oxygen pre having his transplant to go to the toilet, and he was transplanted, and he's now cycling, I think, 4 miles a day, and he's doing really, really well. I'd love to say that I know this man really well. Carmel does more so, and she was talking to him last week and has asked his permission, could we talk about him, and he was delighted for us to speak about him. But it's great to see a positive story, and it's great to see, I've asked your permission, Philip, to mention you, but we have a patient here. It's great to see, like Philip was very unwell when he came to us lately, but you look great today. And it's great to see people up and out and active and trying to be as positive as you can be, and with the help, hopefully, of the doctors and nurses within each department. Thank you. I probably spoke too fast, but